Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Dr. Matthew Baelish. You are a pharmacist with Apple Drugs.
I am. It's
of
good
course,
to be back.
And you're a Pharm D, and
Yes.
you've been on the program before. And the topic for today's program is advancements in blood glucose monitoring.
Yes.
And there's a lot going on in that arena.
It's very exciting.
And of course it has to do with diabetes, which is a very common health problem. So talk to us a little bit about diabetes.
Sure.
And how this all came about with all these advances.
So, as you know, diabetes affects about 30 million Americans, and those Americans have to check their blood sugar to make sure that, for dosing insulin and, watching their carbohydrate intake and exercise and all of that. And diabetes technology has come a long way since the invention of insulin about 100 years ago. The first advancement was, and I remember my grandmother doing this, using the dipsticks in the urine for ketones and glucose, and that was the way she dosed her insulin.
That's all we had back then,
That's
correct?
Right. That was the early 70s or late 80s. And then we had the invention of the glucose monitor, where you would stick your finger and you would test your blood for blood sugar. And that has been the mainstay for the last probably 30 years.
And some people have to stick themselves 3-4 times a day.
Yep, most type 2 diabetics 3-4 times a day. Type 1 diabetics, you can test upwards of 10 times a day. So that's 10 times sticking your finger, which can get very depressing, frustrating, and it's painful.
Sure.
So in the last 5 years, we've had more advancements in technology. Now we have continuous glucose monitors where we use a sensor under the skin that's adhered to the body, and it stays there for 10 to 14 days, and it will allow you to check your blood sugar without sticking your finger. And it's amazing technology.
I know, so we'll get to those last. I know first you wanted to mention the traditional device.
Yes.
Let's take a look at that, just from a historical
So
perspective.
from a historical perspective, most people that are living with diabetes are familiar with your basic blood glucose monitor. This is an AccuCheck. There are numerous monitors on the market, and they all do about the same thing. You put a test strip in, you prick your finger, you apply the blood, you get a number. In the last 5 years, they've added functionality to these by adding Bluetooth technology and an app to go with it.
Because previously you would have to keep a log and just write down the date, the time, the reading, and so forth.
And that is very hard for people to do. So they've kind of made that easier with technology. So the app that goes with it will allow you to log that data, and we can talk more about that. But this is, the basic glucose monitor that you have to do the finger stick with.
And of course you have to have on hand the lancets to prick.
Yep, the lancing
finger each
device,
time.
the lancets, the alcohol pads. It gets cumbersome. And so this has been the standard.
And there's another brand too,
Yes,
isn't it?
there
One
is.
Touch.
One Touch is another brand, and I brought both of these because they have both made the advancement of developing apps and having the Bluetooth technology and connectivity. One Touch gives you even the color-coded low, medium, and high. So it will give you an arrow and it color codes it, which is another functionality. But
Sure.
the Bluetooth technology and linking this to an app allows for easier download. Most diabetes educators like to download the meters, and each company has a software for analysis. So, for example, if you came in and talked to our diabetes educator, John, and you brought your meter, we would plug it in, download it, and we have a program that will map out all the data.
Like along a graph of some
Along
kind?
a graph, and we can print it out for you, and we can send it to your doctor, and it'll show your highs, lows, time and range. It's very functional, and it helps people visualize more than just a number. So it allows you to start putting those numbers into context. But this is kind of the basic standard technology.
I guess that's very helpful with insulin dosing,
Yes,
especially
it
early
is.
on when you're trying to find the right balance.
Most definitely.
Yeah.
But the big problem with that is the finger stick. Nobody likes to stick their finger. So one of the nice advancements in finger stick technology for people still using a glucose monitor and they have to prick their finger is the Genteel device. And this is a new style of lancing device, and it will allow you to get a less painful or no painful finger stick. It'll allow you to stick your finger, it'll allow you to do the palm of the hand and the arm, so it allows for multi-site testing, and there's a container that you change for each site. And the way it works is you apply it, hit the plunger, and it will pull a vacuum, and it pulls your skin up and you don't feel the finger stick. And there's a little raised area, and
So
obviously
it's bringing the blood to the surface.
it's bringing the blood
where
to
it
the
can
surface.
Be sensed.
And so it gives you a better sample and a less painful finger stick. This is the only product on the market that is for less painful finger sticking.
So it's not a prick per se. It's just a way to bring the blood to the surface.
No.
It feels like a prick, or
it will lance the skin and bring the blood up, but with the vacuum, you don't feel the lancet.
Oh, okay. So you're still getting a prick.
So you're still getting a finger stick, but you don't have the pain associated with it.
Okay.
We typically recommend this to people that have very sensitive hands. It's great for little kids that are doing lots of finger sticks. People with diabetic neuropathy, this may help kind of encourage them to keep testing because they don't have the pain associated with it.
Plus, you can move it in different
Right,
areas
and
of the
you can do
body
what we
versus
call-
always keeping it at the tip
Right.
of the finger.
And that's called multi-site testing. So you can do your finger. There's a cup that is for the palm of the hand. You can do your forearm. There's one for your leg, which probably won't get caught on camera. But you can do multiple spots
Right.
where you have fewer nerve endings.
Okay.
So this is an option for people that really have trouble with the finger sticking, if they're still using a traditional glucose monitor.
So there are lancet type devices that you have to have
You
on
have-
hand to use with that.
You
But
just have to have, this takes if memory serves me, a one-touch, it takes a universal lancet.
oh, okay.
And the lancets are very inexpensive. They're about $12 per 100.
Okay.
So the device itself may or may not be covered by insurance, and it's about $120.
But that's a one-time.
But it's
expense.
a one-time expense.
Okay.
Yeah. So that's the advancement in finger sticking technology.
Okay. So now we're on to the more advanced ones.
Right. Now it's the fun stuff.
Okay.
So continuous glucose monitoring has been something that the diabetes community has been waiting for. With the traditional glucose monitor, it's almost like you're wearing a blindfold and you're looking at pinholes because you have a very limited set of data to make your decisions on.
just
You have
those 4 times a day. or
4
whatever
times a
that-
day, 8 times a day. You have these little points of numbers, but you don't have the overall picture of what is actually going on. That is the best we've had, but now with the advances in technology, we have sensors. We can insert them under your skin. They stay on your body for 7 to 10 days, depending on the product, and it reads the glucose concentration between the cells of your skin. And using an algorithm, you then correlate that to what your blood sugar is. So that is a much, it's convenient. It stays, you don't have to stick your finger. You don't have to carry around your glucometer. All you have is a sensor on your body. Typically it's on the arm. You can place it on the back, depending on where. Some people wear it on the leg. But as long as it's on your body, it will sense the glucose. And then that transmits that data via Bluetooth technology to some form of receiver. So the options are you can transmit it to a carry receiver. It looks like a little, it looks like an iPod. It has a little touch screen and a
Okay.
keypad, and that's one way to do it. The other nice thing with the Bluetooth functionality, you can actually have it go right to a cell phone.
Nice.
Yes. So now you have a way to look at your almost 24 hours of data and see really what you're doing. The example diagram I sent shows a full 24 hours of glucose monitoring with one of the systems, and you get 200 readings in a day, every 5 minutes.
That's a lot more information.
It is.
Yeah.
And the other thing that the algorithm will do, based on that number that the sensor gives the algorithm, it will predict whether you're going up, going down, or whether you're steady. So now you can say to you, if you're wearing one of these sensors, if you're at 80 and it's trending steady, you know that when you eat lunch in a half hour, you don't have to correct for your blood sugar potentially being up higher.
Okay.
It will also prevent lows, and that is one of the most important things, particularly for our type 1 diabetics or our type 2 diabetics that are on insulin therapy that can have low blood sugars. This will predict that.
Very good.
Yes.
I know one model you wanted to show us first in this category is the FreeStyle Libre.
Yes, the FreeStyle Libre is made by Abbott. They have been in the diabetes game a long time. They make the FreeStyle line of testing products. Very standard. They make a good product. This is the Libre system. It consists of a receiver that the person carries, and this is an example sensor. And so this sensor is adhered to the skin with an applicator, and it's probably not going to show up on camera, so hopefully you can put in a picture.
You can
see
a
that
tiny
filament?
Yeah.
That filament goes under your skin and senses the interstitial or skin glucose.
And you can put that on yourself? Or?
Yes, you can. It comes with an applicator. You push a button and it pops it right in.
Wow.
One time. And from people that have put it on, painless.
So you're not even getting a prick from that?
No,
because
you're
it's
not.
more of a filament than
Yes,
a
and
needle.
it kind of goes sideways under the skin. And the adhesive is good for 14 days. This is a 14-day system.
Now, is this even with showering or whatnot?
Yes, most definitely. Showering, swimming, sports,
Wow.
everything. Certain activities, if you were to take up wrestling, you would probably want to put something over this like an ACE bandage to keep it in place. But for most sporting events, as long as it's not in, as long as you're not playing tackle football, probably it'll be fine.
Sure.
But for 95% of people, keeping it on the arm, it works great. So what you do then, instead of doing a finger stick, you're a type 2 diabetic, you're out at dinner, oh, I need to dose my insulin. Let me see what my blood sugar is. You put it over the sensor, and it gives you a number. 89, 129, 350, and it gives you that. It also stores the data, which you can then download and analyze with your endocrinologist, with your diabetes educator. So it's a great tool for managing diabetes without the finger stick, without the glucometer. As far as costs go, most insurances will cover it with specific criteria, of course. You have to be on insulin 3 shots a day. You also have to be testing your blood sugar at least 4 times a day.
Is that for all insurances? Or?
That is Medicare and most insurances. If Medicare does it, most insurances follow suit. It's also good for depending on where you get it, we're going to need notes from your doctor, and your doctor needs to write that in there. Testing blood sugar at least 4 times a day. Patient is taking 1 shot of Lantus and 3 shots of Humalog with meals. That has to be in there, or Medicare will not pay for it. And they're getting Medicare likes to audit.
Right, right.
So we have to have that documentation.
Now you're
But it's an
saying,
amazing
if you
system.
have to buy a box of Lancets, of course, I guess insurance covers that too. I'm wondering if it's comparable to changing that every, 10 days?
So
or
the
14?
cost of this system, if you walked into the pharmacy with a prescription, because you do need a prescription for this, and you said, Matt, I just want to buy it, the receiver is about $70, and a 14-day sensor is about $70. That being said, if you had to buy test strips out of pocket, they're about $80 to $120 a box, depending on where you get them and what brand. So It is expensive, but in the long run, it's going to be beneficial because with this data, most people will improve their A1C, which will reduce your cardiovascular risk, and you'll be healthier.
Sure.
So you'll be avoiding hospitalizations, blindness down the road, hopefully, all the complications of diabetes. That's the theory anyway.
Right. Well, the research all says if
Yes.
you keep your sugar within the normal limits most of the time.
You should avoid those complications.
Yes.
So
it's
this
important.
product will help you hopefully reach those goals without the finger sticks.
Now I think you have one
I have
more
one more.
top of the line system
Yes, I do.
to share.
And that is the Dexcom system. Dexcom is similar to the Libre, but it has some more functionality.
And I've seen that advertised quite a bit on TV, so I guess more people are aware of it now.
Yes, they are. I've been using it in my daughter for about 3 years now. Dexcom, again, you have a sensor that goes on the skin with a filament that goes under the skin, reads the sugar concentration in your skin, correlates that to your blood sugar. It has a Bluetooth transmitter, and that transmits to also an iPod-like device receiver, or it can be transmitted to a cell phone. They also have an app where you transmit it from the person that uses it to other people. So if you have a child, the child's data will go to the parents and the school nurse, or if it's husband and wife, the husband or wife can share the data with each other. The other functionality is the Dexcom system. You don't have to hold the receiver over the sensor to get a reading. It gives you an automatic reading every 5 minutes.
It's just transmitting.
It's just
to
transmitting.
that receiver or
As
phone.
long as you're within 20 feet
Okay.
of that transmitter, it will get a signal. And the parameters of the Dexcom, it will alarm when you go below 70. It gets really obnoxious when you get around 50. It gets really loud.
Now, when you say alarm, where's that alarm coming from? The phone?
phone.
Or receiver would be
The phone or the
programmed.
receiver.
Okay.
So, for example, for my daughter, both her phone goes off, my wife's phone goes off, and mine. So in the middle of the night, one of those phones is going to wake us up if she is below 70. And that is a tremendously good piece of functionality because type 1 diabetics, if they're asleep, they don't feel the low.
Right.
And you just don't know. Before you had that technology, you were getting up 2-3 times a night to do finger sticks. The first year, that's what my wife and I did. It was brutal.
Mm-hmm.
We would get up at midnight, 2 a.m., 4 a.m., 6 o'clock, and you did finger sticks and hope that you caught a low.
And insurance pays for this
Yes,
as well?
most
Of course,
definitely.
most people have a cell phone, I imagine, that
Yep.
they use as their receiver, so that's one less cost, but you
Yes.
have the sensor
Right.
cost.
So the Dexcom system is definitely covered by insurances. Depending on your insurance, it could be covered through your pharmacy benefit, or it can be covered through your medical equipment benefit. So you have to inquire about that. The cost of it is a month of sensors is about $300. It's more than that if you wanted to pay cash. I'm not going to quote you the cash price. That might scare people. But it is covered by most insurances. Again, as long as you meet the criteria. Multiple insulin shots a day, multiple testing. Dexcom is also covered by Medicare. So again, with the same criteria, Medicare will pay for it. And that's a good thing. So the Dexcom system, particularly if you're type 1, insulin-dependent diabetic, that's the system you should look at, definitely. The functionality of the alarms and the alerts, it's going to prevent needing glucagon, hopefully. Having those ultra lows where you have to go to the hospital.
And of course, getting too high, which is also dangerous.
Exactly.
Yeah.
That is the other thing. It will help you keep in range. The Dexcom system also has a portal for clinicians called Clarity. And you can send your diabetes educator, your endocrinologist, a code, and they can log in and they can look at all your Dexcom data. So, for example, when my daughter goes to see her endocrinologist, we don't look at finger stick data anymore. We log in and look at her Dexcom data. And FDA has approved that product for making treatment decisions. So you can make decisions on, well, you know, her average it'll give you an average A1C, which is a 3-month blood sugar snapshot, and it'll also give you reports and break down your highs, your lows. It'll give you what we call time in range, and time in range is between 70 and 180, that spot where we want to keep you for no complications. And I believe Dexcom posted a study that showed use of a CGM keeps you in range more time, and again reduces complications.
Well, it
Amazing
certainly makes sense. It is. It is amazing. But you're saying all these need a prescription by
Everything
your
I've talked
provider.
about needs a prescription.
Yeah.
Yes, ma'am.
And of course, the local pharmacy, including Apple Drugs,
Yes.
but any local pharmacy, I imagine many of them provide a service of helping you with learning the technology.
I don't know about other pharmacies. I know Apple, by appointment with our diabetes educator and our other specially trained staff, will train you how to use this equipment. It's by appointment, and we gladly do it because keeping you healthier will, you know, reduce your
Sure.
overall cost.
I just imagine it could look daunting to some people.
It,
you know, the
it
technology
most definitely
involved.
can look daunting. And that is, you know, for the elderly, it can be very daunting. Low vision people, you know, if you have those sort of hurdles, we try to teach people how to use these. But yes, it can be daunting. But using this technology, learning how to use it, or having someone help you learn how to use it, will pay you benefits down the road. The oldest gentleman that I helped with the technology was 83. And he wore a Dexcom for several months, and he liked it.
So it looks like this technology is a real lifesaver, you know, for diabetes patients.
This technology most certainly can be a lifesaver. It is something that can keep you from going into hypoglycemic crisis, which can be fatal. That low blood sugar, you know, preventing that is key in people taking insulin, our type 1 diabetics, people on an insulin pump. The other thing it does is it alarms and tells you when your blood sugar is too high. So over the long term, it can help you tailor your diet, exercise, and keep you in range and healthier longer. So either way, it's going to be a lifesaver.
Right. Well, thank you so much for coming
Yes.
on the
You're
program
welcome.
and bringing all your devices. And I know you also, we're going to post some websites at
Yes.
the end of the program where people can get more information in general and about some of these devices. And we really appreciate it. It's just great news.
Yes, thank you.
And thank you for joining us for this edition of Focus on Health here on PAC 14.